A special thank you to OhioKAN, Ohio Kinship and Adoption Navigators program, for supporting this presentation and bringing information about ADHD to kinship caregivers. We hope this presentation will provide some helpful strategies for ADHD. It is presented by Sydney, who just earned her doctorate in occupational therapy. So we're very excited to bring this information to you all in a partnership between OhioKAN and KCC.
Hi everybody, my name is Sydney and I will be sharing some information about caring for children with ADHD and some strategies to go along with that. I want to start off with a Morgan Harper Nichols quote since we typically use her affirmations during support group. And so this one reads, "Write your plans in your pencil, leave plenty of room for change. You may not know what lies ahead, but you will grow in wisdom each day." And here's a little roadmap to show how the rest of the presentation is going to go. So I'll share some basic information about ADHD and then some strategies around physical activity, mindfulness, sensory, and behaviors. I'll share some intervention options and resources that are in Ohio and nationwide. And then strategies for your all self-care will be suggested throughout too. I want to highlight the term neurodiversity, and it's the idea that people experience and interact with others and their environment in different ways, and there is no right way. And so there's a push towards acceptance and inclusion of all people, regardless of their neurological differences. The term neurodiversity is often used in context with autism and ADHD, and it's not uncommon for those to co occur. So, 30 to 65% of children with ADHD experience symptoms of autism, and then 22 to 83% of autistic children meet the diagnostic criteria for ADHD.
This graph is helpful because it shows some of the signs and symptoms of ADHD and autism and where they might be different and where they could overlap. For ADHD, forgetfulness is a big one. So, forgetting something quickly after you told a child, or even needing reminders for things. Impulsivity means acting quickly on a thought. So, this could look like running really quickly in a time where it might not make sense, or even interruptions can be an example of impulsivity. Time blindness, this means not being in tune with how much time has passed. So that can be really focusing on something and thinking only 5 minutes has passed, but it's been 30 minutes, or running late to things because not being able to keep track of that time. And then inattention, difficulties with planning and thinking things through logistically. And finally, interrupting. In the middle category that shows some of the overlap in symptoms between ADHD and autism, we see sensory issues, and that can mean needing more input from the environment. So that might mean looking hyper and running around a lot. And kids can be more sensitive to things in their environment. An example is if a child feels sensitive to the tag on their shirt, or can be selective about what kinds of clothes they wear, what kinds of food they eat, or it could be being sensitive to sound. So sensory, it could be different for each sense. Emotional dysregulation. This can be a roller coaster of emotions, seeming very calm at one second, but then very emotional the next. Difficulty with change, and that really shows the importance of routine, which Sydney will talk about. Hyperactivity and restlessness, and then social difficulties, which some of this may come with interrupting or talking a lot about topics a child is interested in. And this is not to diagnose or anything. These are just things you could look for and bring up to your doctor if you have concerns about. And it is interesting because children who have experienced trauma are more likely to have ADHD and autism, and sometimes the symptoms of trauma can overlap with the symptoms of ADHD. So that is important to keep in mind as well.
And now I'll share some basic information. So, attention deficit hyperactivity disorder, commonly known as ADHD, is a neurodevelopmental disorder defined by impairing levels of inattention, disorganization, and/or hyperactivity or impulsivity. And that neurodevelopmental piece just means that there's an impact on the development of the brain. And ADHD can present differently in different people too. So, one may present predominantly inattentive, or may be predominantly hyperactive and impulsive, or it could be a combined presentation of both. And here's more information about the aspects of ADHD, specifically some of the behaviors that you may see. So, with inattention, that could look like wandering off task or having difficulty with focusing. It could be not following instructions or not finishing chores or homework. And then also just disorganization. And inattention is pretty common for the elementary age of children. And then there's hyperactivity. So that could be excessive motor activity like running around, climbing, jumping when it's not necessarily appropriate. And this is common for the preschool age. It could also look like a lot of fidgeting or tapping, which is more common in adolescents. And it could also be excessive talkativeness. And then impulsivity could be social intrusiveness, like interrupting others. It could be making decisions without thinking about the consequences. And then it also is a result of decreased executive functioning. So, executive functioning is usually impacted when one has ADHD. And executive functioning, it's a set of cognitive skills that help us to do a whole slew of things. So, we can regulate our emotions and behaviors, use working memory, focus and attend to things even with distractions, organize and plan ahead, problem solve, and use impulse control. So, when that executive functioning piece is impaired, it can be hard to use impulse control since that functioning is what overrides impulses typically. So, now I'll share some physical activity strategies. There are multiple benefits of physical exercise for children, other than it leading to a healthy lifestyle, but it can improve motor skills, decrease disruptive behaviors, improve social functioning, and improve that executive functioning piece. So I have a list of games here that have a level of cognition in them too. And these games specifically encourage following directions, sustaining attention, and managing impulses. So I have listed here Simon Says, Red Light, Green Light, Duck Duck Goose, Freeze Dance, and musical chairs. And some of these you may need a larger group of children to play with, but others you may just be able to do with the child or children in your care. And for some more suggestions, I have a nature scavenger hunt. And this would encourage planning ahead and use of working memory because one is having to remember what they're looking for and think about it in advance. I have an example of one to the right here. And I like this example because it gives those concrete things to look for, like dog, pine cone, but it also allows for a level of creativity with looking for something orange or something blue. And then obstacle courses or relay races encourage problem solving skills and impulse control. And then organized sports like soccer, basketball, football, volleyball, and so on. These encourage an increased attention span with having to attend during practices or games. And they also increase one's social skills. And now is just a time to reflect and think about how have you noticed these types of physical activities impact the behavior of the child in your care? Or if there are any other physical activity suggestions that have helped the child in your care. And now we'll get into a little bit about mindfulness. Mindfulness is focusing on the present moment without judgment or reaction. So it involves choosing a point of focus and sustaining attention on that point. And so it can look like mindful meditation with breath work, or it could be mindful movement with yoga. The benefits of mindfulness for children and adolescents specifically include improving attention and focus, decreasing stress, improving self awareness, and improving self regulation. And that self regulation piece is just being able to recognize one's emotions, behaviors, and how they're feeling physically, and be able to respond to that in a healthy and regulated way. I do want to note that these strategies are typically more effective for adolescents rather than younger children. That's not to say that they can't be used with younger children too, because every child is different. So you could use visualization, which is creating a mental image in the mind and focusing on that rather than what's going on around you. And you could also use active movement like yoga or guided dancing.
The caregivers in our support group actually mentioned that she has a daily yoga routine with her grandson. So it's something that they do together and they enjoy together. She started off doing it on her own and then invited her grandson to join. So they do it in the mornings, and it's something that he looks forward to now. And she says it has really helped him with starting the day off right and learning some mindfulness skills.
So I have some examples here. On the left just shows an example of visualization with somebody picturing different types of weather in their head. And then on the right here are some kid-friendly yoga poses, which can be more engaging for younger children, especially if they have fun animal names in them, like jellyfish pose or butterfly pose. I also want to share that mindfulness strategies can be used for your all self care as well. So, mindfulness for adults can decrease stress, improve mood and well being. It can help with decreasing negative thinking and distractions, and it can reduce depressive symptoms. So, some of the suggestions I have here include mindful eating or listening. So, that's being very present with your meal, really taking the time to chew through the food and think about what you're tasting, or just really listening to your favorite song with the instruments and the singing, or a podcast. You could also journal and write down how you are feeling in the moment each morning or each evening. And then, just in general, having check ins with your body, thinking about how your head, your stomach, or your heart is feeling. And I want to just encourage everybody to take a moment to think about if they use any other mindfulness strategies to check in with themselves. I'm also going to share a grounding 5 4 3 2 1 strategy next. So, this can be used for you or for the child in your care if you happen to be feeling overwhelmed, if the child in your care happens to be dysregulated. This is an opportunity to use five senses to bring yourself back to the present moment. And it's called the 5 4 3 2 1 grounding technique. So, it's five things you can see, four you can touch, three you can hear, two you can smell, and one you can taste. And I know at times I've had difficulty thinking about four things that I can touch, but one of those answers can just be I feel my feet planted on the ground. Or if you're outside, I feel the wind in my face. And then another one sometimes that can be difficult is what's one thing you can taste? Because we're not always eating food. So it could just be the aftertaste of your toothpaste or whatever you had for breakfast that morning. And now we'll go over some sensory strategies. For a quick overview of the sensory system, that's the part of our body that processes sensory information. So it helps us to see, hear, smell, touch, taste, as well as feeling our body in space, and it helps us with our balance and movement. There are several benefits to using sensory strategies too, so they could address behavioral issues. At times, an unwanted behavior could be happening because a child's sensory need isn't getting met, and so that's coming out in a different way. It could also help with improving self regulation skills, lead to less avoidance of a sensory input that typically bothers somebody. And it can also help with improving skills like play, self care, and social interactions. I'll start off with some vestibular strategies. And so this deals with movement and balance. So for homework times, you could add structured movement breaks, something like stretching, jumping, a short game. But I also encourage setting timers for those breaks so that it doesn't turn into a 30-minute play session or turn into a battle with getting back to homework. And then for some more movement, to alert or wake somebody up if they're a little tired, rotational movement helps. So that could be spinning or being on a tire swing. And then on the flip side, to calm somebody down, linear movement helps with that. So that could be rocking or swinging back and forth on a swing. Here are just a couple of movement break card examples. So it could be something simple as a quick stretch break or a short game of red light, green light. Next, we have proprioceptive strategies. So, this has to deal with how we feel our body in space and also how we feel pressure. So, using a weighted vest can help during homework times. Several studies have shown that it can help with attention, processing, and executive functioning.
Quick note about weighted vests. You do want to make sure that the weighted vest is appropriate for the size and weight of your child and that it isn't too heavy for them. So there should be guides for that when ordering the vest, or you can also consult an occupational therapist if your child works with an OT.
And then pressure can also help with calming. So you could have your child wrap up in a blanket, give them a hug with a light squeeze, or have them do heavy work. And heavy work could be carrying a laundry basket or a stack of books. It could be doing some wall push ups or even climbing on a playground set. But it's getting that weight and pressure through the arms and legs that can help to calm.
Sports are a great way for kids and also teens and adolescents to get exercise in and that heavy work where they're running, jumping, playing, and especially having this after school can help them get in the right mindset to come home and do homework. So sports are a great way and a common way that kids can get this heavy work in.
We also have some auditory strategies. So, some studies have shown that white noise can help during homework time with improving attention and decreasing hyperactivity. So, you could use a white noise machine, or you could even just go on YouTube to find a clip of white noise as well. And then, if somebody is sensitive to loud noises, you could use noise canceling headphones. I do want to encourage using these in moderation though.
And by moderation, we just mean using the headphones when the child really needs them, if there's something in the environment that is overwhelming to them. We don't recommend necessarily having them on the child all the time without monitoring, because this can actually increase a child's sensitivity to noise and kind of make the situation harder when they don't have those headphones on.
And then to calm, it can be helpful to play rhythmic and melodious music. So, sensory strategies can really be for anybody, and everybody has their own sensory needs. And so, as a self care strategy, I want to suggest creating a sensory calming space for yourself. You could make it a designated area of your home. And if you're making this, you just want to set the environment up to have dim lighting and be quiet or have some soft music. And you can add different items that help to calm too. So, if you really enjoy the scent of candles or essential oils, those could be included for some aromatherapy. A weighted blanket or a heating pad or heated blanket could help. And then just pillows too can also be calming. So here are some examples there with a corner of pillows piled up and some candles.
Children and adolescents, especially, essential oils and aromatherapy can especially be helpful because you don't have to worry about the fire hazard of candles, and those are really sold widely everywhere, so you can have different scents for the child to choose from as well, which is really fun.
An eye mask to block out some light, and then just a dimly lit area with some headphones to listen to your favorite music. You could also make your own sensory kit. And so these kits just include items that stimulate our senses in different ways. But you could add fidgets like stress balls or fidget spinners. You could have a mini Zen garden, and I'll show what that looks like in the next slide. You could have a sound machine or an adult coloring book or a paint by number if you want something to do with your hands, those candles and essential oils. And you could also include a pack of gum. And most of those strategies are more calming, but the gum is something that can help to alert you if you happen to be feeling tired or slow one day. That mintiness can help to wake you up. So, here are some of those examples with the mini Zen garden on the left and an adult coloring book in the middle if you enjoy having something to do and just focus on that for the time being. And then also a stress ball is pictured here. And now is just a time to reflect and think about what would you add to your sensory space or sensory kit to personalize it to you? Or if you already have some of these in place, is there anything that you might add to them? And now we'll get into a little bit about behaviors. I really want to emphasize that every behavior has a reason or a purpose behind it. And as caregivers, it's important to be the detective and discover what those reasons are rather than focusing on just the behavior itself. And these are some of the reasons behind behavior. So it could be to get something they want. So behaving in a certain way to get attention or access to a toy. It could be to avoid or escape something they don't want. So behaving in a certain way to avoid homework time. And then the last reason is that a sensory need is not being met. And so, if somebody is overstimulated or understimulated, then they may be behaving in a certain way. And so, in those instances, it's important to address the sensory need first.
Children with ADHD, especially, I think it's important to start with investigating the sensory needs and seeing if those are being met, because a lot of times children might just need to be getting that proprioceptive input, and we see that as acting out or like not being able to sit down or follow instructions, or really their body is telling them they need to move. So that's an example of really where a sensory need can reflect a behavior, and I think this is a really important starting point, especially for children who are neurodivergent or have ADHD. Another example is if a child is having a meltdown and screaming and crying, they could just be very overwhelmed with the environment around them, and that is how their body is shutting down because of it. So it could look like a tantrum, but really it's a sensory overwhelmed experience.
And before I get into the strategies, I also want to share that they can be used in two ways. So it can be used to prevent unwanted behavior or emotional dysregulation. And then they can also be used after a child is emotionally and behaviorally regulated. But if a child is dysregulated or quote unquote having a meltdown, then generally these behavioral strategies will not be effective. And it's more important in those moments to help with regulating your child. And then it can be helpful to just recognize the signs leading up to the unwanted behavior. It's that detective piece there. So if you recognize the signs, then you can respond before the unwanted behavior happens.
One caregiver in our group shared that when she notices that her niece might start to show signs of getting irritated, annoyed, or worked up, last time that happened, she said, "Okay, let's take a deep breath together." And they did it together, and even her niece said that it really helped her, who I think is about 6 years old. So that's an example of a preventative strategy, providing that calming experience to try to prevent a meltdown.
So, the first behavioral strategy I have here is 1, 2, 3 magic, and it helps to set an expectation without having to repeat yourself. So, you give the child a task to do, and if they don't do it, you say that's one. You wait a couple minutes, and if they still haven't done it, you say that's two. And then after one more minute, if the task still isn't done, then you say that's three. And that's when you follow through with a boundary or a consequence. And you can let them know what this consequence is going to be before you start this counting so that they already know that they have a task to do. And then if they don't do it, then this is what's going to happen. There are also behavior charts that can be used. So, this is a way to visually track a child's behavior throughout the day or a week. And if you choose to, you can also associate a positive reward with filling up the chart, and this can encourage good behavior in the future. And then it can also be a checklist for specific tasks, or it could be a token economy, which I will explain next. So on the left here, we have an example of a behavior checklist, and these are tasks that are set up for a classroom, but you would be able to make your own checklist for in the home as well. And then on the right here is a token economy. And so that's when the child is working towards something. And each time they do a desired behavior, so each time they say please, each time they clean their room, they get a token or that check mark. And then they're one step closer to getting time with their Rubik's Cube or whatever that is that they are working for.
I will say a behavior chart or checklist working towards a positive reward can be very powerful for kids, especially if kids, have previous trauma or don't like when things are taken away from them because they feel a lack of a control. Putting a positive spin on it and really finding something that's motivating for them to work towards and something fun, maybe even something you can do together. This can be a more positive way to address behavior and motivate the child to work towards their goals. And you can show them if they haven't completed the checklist or haven't done the things that they were supposed to that week, they might not get it that week, but then you can work towards adding more checks the next week or whatever it is. So it's a great visual and a great motivator as well.
In general, positive reinforcement can be pretty effective too. So, positive reinforcement is when a consequence is presented immediately after a behavior. So, for good behavior, when a child shows a good behavior, you can immediately provide verbal praise, some sort of treat, or a token or a mark if you're doing a behavior chart. And this increases the chances of the good behavior happening again in the future. Routines and schedules can also help, especially around difficult parts of the day. So maybe that's getting ready for school or homework time. But for these routines, you could use a visual schedule for reminders of tasks. And so that's when words are tied to the pictures, and the child typically can check off what they've already done. You could also break up bigger tasks into smaller ones. So that's when those movement breaks can come in handy. And then, in general, with different routines or schedules, just keep realistic expectations about time and also praise their effort, not just their results, so that they feel encouraged to keep trying. Here are examples of two visual schedules, both of which have pictures tied to the words. The one on the left has specific times tied to it, but you don't always have to have times tied to these visual schedules like the one on the right. But both of them do have a way to check off tasks once they are completed.
I will say for children with ADHD, time blindness can be a symptom of that, which means it's hard for them to be aware what time it is. They kind of lose track of time. So, something that can be really helpful with a visual schedule if you are using times is to pair it with a timer that lets them know when it's time to move on to the next task. There are plenty of free timer apps made especially for kids that you can download on smartphones, and they use different visuals when using a timer that can help with the child seeing how much time is left.
And this is just a moment to reflect on these strategies. So, do you have other strategies that have worked for the child in your care? Or have you used any of the behavioral strategies that were mentioned? And if you did, how did they go? One more self care strategy I have for you all is called behavioral activation. And so it comes from the idea that our behaviors, thoughts, and emotions are all connected to each other and they all impact each other. And so behavioral activation uses behaviors to influence our thoughts and emotions. So if you notice yourself having negative feelings or thoughts, you could use a positive behavior such as taking a quick walk, a stretch break, or a dance break. And the goal in mind is to change those feelings and thoughts to be more positive since your behavior is positive. Now I'll share a couple of intervention options and resources that are in Ohio and nationwide. So, occupational therapy is an intervention option, and OTs can address time management, organizational skills, executive functioning, social skills, sensory regulation, and behavioral regulation. And then for some other types of therapy or counseling, it could be behavioral treatment, cognitive behavioral therapy or CBT, and that's really focusing on changing behaviors and thinking. Social skills training, parenting skills training, and that's when the caregiver is learning from a professional about skills and strategies that can be carried over into the home. There's psychotherapy, which is talk therapy, and then family therapy too. And then medication is also an intervention option for those with ADHD, but I want to also very much so encourage consulting a physician if you do go the medication route. And if you have concerns but don't yet have a diagnosis of ADHD for the child in your care, don't keep those concerns to yourself. You can always set up a meeting with your pediatrician for a discussion. And I do want to share some notes about how diagnoses in younger children can be difficult since developmental delays at times can be mistaken for ADHD. And then in general, it's less common for younger children, typically before the age of 12, to be diagnosed unless the core symptoms of ADHD are present and are they're there across all environments that the children is in, so home, school, the community. And now I'll get into those resources, and there will also be a resource page shared on the KCC website full of more detailed information about each resource, as well as links to specific pages. So, the first one that I want to share is Ohio Minds Matter, which really shares information about behavioral health, but they do have a specific ADHD info page, and they also have a shared decision making toolkit, which can be printed off and taken to appointments. But it just helps with guiding families, including caregivers and young people, through the shared decisions of treatment. And this can especially be helpful for adolescents or those who are going to transition into adulthood soon so that they can feel like they have some autonomy in their care and it can prepare them for that independence. Triple P Positive Parenting Program is another Ohio resource, and it provides information to support caregivers in positive parenting practices. So, two highlights that I want to mention, they have online courses for 0 to 12 years and then for teenagers. And both of these programs are free. And once you sign up for them, once you're registered, you have access for the following 12 months. And we have CHAD, which stands for Children and Adults with Attention Deficit Hyperactivity Disorder. And it's a virtual resource that provides loads of education for those with ADHD and their families. And one of the highlights that I want to mention are these videos here. And so it shows videos from the perspective of a child, and it helps them with learning different skills, and handouts go with each video. So some examples of those are how to use a calendar system, how to manage emotions, and creating daily routines. Attitude is a virtual database of articles full of education around various topics. And so, one of those that I want to highlight, they have an ADHD parenting page. And so, these provide a comprehensive guide for parenting a child with ADHD. And some of the specific topics that they have are behavior and discipline, positive parenting, teens with ADHD, schedules and routines, organizing your child, and health and nutrition. The American Academy of Child and Adolescent Psychiatry has an ADHD Resource Center page, and I want to touch on their Parents Medication Guide, which includes several different guides over medications that can be used with those with ADHD. And so they have an English version, a Spanish version, and they have a guide for those who have ADHD and autism. Harvard University's Center on the Developing Child has a page that is specific to activities for executive functioning. And so it's a virtual guide that shows different activities for different age levels of executive functioning. So they have the ages 6 to 18 months, 18 to 36 months, 3 to 5, 5 to 7, 7 to 12, and then adolescents too. So the executive functioning strategies are specific to that developmental age range. Study Tools by Jules is a virtual resource that may be able to help with homework time, but I also wanted to highlight her blog because she shares some short reads that are full of tips and suggested resources. And some of those resources that I've seen recently include picture books for kids with ADHD about emotional regulation and self awareness. She also mentioned an ADHD podcast for kids specifically. So, a lot of good resources on this page. And lastly, I want to share the Attention Deficit Disorder Association, ADDA. They are another virtual resource that provides support mainly for adults with ADHD. So I wanted to share this one for those who have children in their care who may be aging into adulthood soon. And this organization has various support groups that those with ADHD can join. They have a beginner support group, those a support group for young adults, and so on. So they have very specific ways that can support those with ADHD. They even have work groups at times where people can get together, hop online, and it's just an hour to work on and be productive at the same time and hold each other accountable. And that is all I have for you all. Thank you so much for listening. And I hope that some of this information, the strategies, and the resources can be helpful. Thank you again.